social transformation through occupation. Through occupation. That reveals that art-based occupations such as creative expressions are commonly used to promote social change, especially in these marginalized communities. So you can see, like I said, the synergy here. That's the pedagogy of social transformation and then occupational therapy. So as we move on, the vision of WFOT and social transformation, that's the World Federation of Occupational Therapy. We have here, one, I think the logo really is, the vision is clearly demonstrated in this 2024 OT Day logo. That is the promotional community-based rehabilitation occupational therapy for all logo, as we can see on the screen. At the heart of the World Federation of Occupational Therapists vision is a commitment to promoting health and well-being through occupation and ensuring that occupational therapy services are accessible to all, as we can see from our logo. WFOT envisions a world where individuals, groups, and communities participate in occupations that allow them to live meaningful, healthy, and productive lives. So, as I move on, this vision, while looking so ambitious, it aligns seamlessly with the theme of social transformation. Social transformation speaks to structural changes, yes, in society that improve the quality of life for all, particularly for marginalized and vulnerable populations. Occupational therapy, with its holistic and person-centered approach, is uniquely positioned to drive, this movement. So we address the complex interplay between individuals and their environments, recognizing that health is not just about curing illness, but about enabling people to fully participate in their daily lives, work, play, and community. This brings into recognition one of our commonly used models, that is the PEO, which is the person, environment, and occupational levels. The global vision for OT emphasizes on inclusivity, accessibility, and empowerment for all people, regardless of age, ability, or background. This vision is guided by very pertinent principles that align with global health and social equity. So when we talk about inclusivity, occupational therapy aims to ensure that all individuals, including those from marginalized and vulnerable populations, have access to the care and resources they need to lead fulfilling lives. Inclusivity means recognizing and addressing barriers to participation, whether they stem from physical, social, economic, or cultural factors. So how do we ensure inclusivity? To the OT, it's very straightforward. One, this is our style of, caring. That's the person-centered care. Each individual's unique needs, preferences, and life context are at the center of OT interventions. therapists design interventions based on the individual's cultural background, experiences, and aspirations, ensuring that care is tailored and relevant. And this is inclusivity. And we also consider cross-cultural practice. As OT becomes more globalized, therapists are increasingly called upon to practice in diverse cultural settings. And I think we can use ourselves as examples. Some of us who currently find themselves some places that they least thought they would be working. So inclusive OT ensures respect for local traditions, beliefs, and social norms, adapting interventions to meet the needs of individuals in their specific environments. Now, let's talk about accessibility. The global vision for OT emphasizes that everyone should have access to OT services. And as you can see, occupational therapy for all, regardless of their geographic locations or socioeconomic status. You know, accessibility is about breaking down barriers that prevent people from accessing the care they need, particularly in the under-resourced regions of underserved populations. You know, I just recently read through a student's project, and it was about assessing OT, that's it, even providing the services and also for the people also to assess the service. And it's a whole lot, loads of, should I say, difficulty areas here. And so when we talk about accessibility, it's a major area that if we are able to sort, we will be breaking some ground. So how do we improve accessibility, you know, especially in this, our region? I don't know whether we have started something like telehealth, and I know we're doing it because we have our mobile phones asking clients their situations, using it to video for environmental assessment and all those things. So these are all ways that we using. So technology has become a major force in expanding access to OT services, especially in rural or remote areas. You know, like I mentioned, telehealth services allow therapists to provide assessments, interventions, and support to individuals who may not otherwise have access to OT. So this is what we need to look into as we go on. And there's also the need for workforce expansion. There is a growing recognition of the need to increase the number of trained OTs. I think we shall talk about this as I move on. OT professionals worldwide, particularly in the low-income countries, and for that matter, we're talking about Ghana. Expanding educational programs and creating opportunities for continuous professional development are critical for increasing accessibility. And there is also this policy advocacy, which we shall talk a bit in depth as we move on. Advocating for policy changes that support funding, infrastructure, legislation around OT services is central to making care more accessible. Many countries are working toward incorporating OT into national health systems to ensure services are more widely available, just like we are also doing our best to do here. And then the third one is about empowerment. It's at the core of occupational therapy's mission, enabling individuals to take control of their lives and fully engage in their communities. OT empowers people to overcome limitations posed by illness, disability, or social disadvantage by providing them with the skills, tools, and support needed to live independently. So getting the people empowered, may involve self-determination, where our interventions promote autonomy and encourage individuals to make decisions about their own care. This involves working with clients to set personal goals and developing strategies to achieve them, which enhances confidence and fosters resilience. And this is what we do. If we are not doing this, please, from today, start doing that, self-determination. And we also looking at capacity building. You know, OT empowers not only individuals, but also communities by building local capacity for health and rehabilitation services. This includes training local caregivers, health workers, and community leaders to integrate rehabilitation practices into everyday life. And I know we're doing some of these things. If I can't remember any, I know there's something like this going on in Dodua. Advocating for rights. You know, the global vision for OT also includes empowering individuals and groups by advocating for their rights to access education, employment, and community participations. So this advocacy is particularly important for people with disabilities who face systemic barriers. As occupational therapists, we have a responsibility to advance this vision and ensure that our interventions not only restore function, but also contribute to broader social change. I like this, that our responsibility to advance this vision and ensure that our interventions not only restore function, but also contribute to broader social change. Now, let's look at the occupational therapy in social transformation. So we're looking at inclusion. We've talked about person-centered, you know, positive future. We're looking at learning, and we're looking at yes, inclusive solutions. This is what we're looking at. The role of occupational therapy in social transformation. Now, I'll continue to say occupational therapy plays a very important role in addressing some of the most pressing challenges of our time. If I say pressing challenges of our time, I'm talking about inequality, unemployment, disability rights, mental health, and more. These are very pressing challenges of our time. And I'm happy to say we actually we play a very pivotal role to address some of these. By empowering individuals to engage in meaningful occupations, we enable them to overcome barriers that limit their participation in society. You know, let me share a few ways in which OT is already contributing to social transformation. You know, we are reducing social inequality. We are reducing social inequality. Many people with disabilities or mental health challenges face significant social and economic disadvantages. Occupational therapy addresses these inequalities by fostering participation in education, employment, and community life. In Ghana and across Africa, where access to health services can be limited, OT practitioners have been instrumental in advocating for inclusive education and workplace accommodations, and also promoting equal opportunities for people of all abilities. You know, it is about everybody getting involved, all right? And we also, like I mentioned earlier, play a very important role in mental health and well-being. And this is one of the ways. Mental health is one of the most under-addressed aspects of healthcare, worldwide, and Ghana is not exception. Occupational therapists are critical in supporting individuals with mental health conditions. And I'm happy to mention this area that our president is one of the big figures in OT and mental health. In supporting individuals with mental health conditions by helping them develop coping strategies, social skills, and routines that improve their quality of life. This has a ripple effect on families and communities, creating more supportive and resilient social structure. Community-based rehabilitation. This is a program that we all have heard about, and it's all about empowering our people in the community, how OT can facilitate community empowerment by working directly with individuals in their local context. Occupational therapists help communities build inclusive environments where everyone, regardless of their disability, can also contribute and participate meaningfully. Advocacy and policy change. For OT to contribute meaningfully to social transformation, we must be vocal advocates for policy changes that affect the populations we serve. Occupational therapists around the world, guided by WFOT's advocacy goals, work to influence public policy, pushing for legislation that supports disability rights, access to education, and affordable healthcare. In Ghana, we must continue to advocate for stronger policies that protect the rights of individuals, especially with disabilities, and promote inclusive environments. I think I'll talk a little bit about this in the next slide. But with all these things, we can't say we don't have challenges. And amidst the challenges too, I think we also have some opportunities. So despite the clear role that OT can play in driving social transformation, there are significant sort of challenges that we must confront, particularly in Ghana. First, there is critical shortage of trained occupational therapists. The demand for services for outstrips supply, especially in rural areas. And if you look at the table I have over here, in Ghana, I think our population now is over 30 million. Registered OT practitioners, about 187. This starts, I think it's, if I can get it right, from Occupational Therapy Association of Ghana, and it's, I think, up to 2023 also. So registered occupational therapists, that's 81. Registered OT practitioners. Okay, registered occupational therapists, 81. Registered OT technicians, that is 106. And we also have registered OT not practicing in Ghana, about 40 of them. And then registered OT technicians not practicing, about 46. So we have about 86 of our trained practitioners not functioning. Wow. So the current state tells us that OT in Ghana is our 41, and then OT technicians are 60, and therefore the total is about 101. So if you look at the ratio of current OT to Ghanaians, I haven't seen this ratio anywhere. One OT is to about 837,000, and that of OTT or OTA is 1 is to our 558,000. So if we talk about number of trained OTs and OTAs or OTTs being very low, I think these figures alone can tell us about that. Additionally, there's still limited public awareness when we talk about public awareness. All right, there's still limited public awareness of the scope and the value of occupational therapy services. Many people, including other healthcare providers, do not fully understand what occupational therapists do. This lack of awareness can limit the reach of our services and prevent individuals who need help from seeking it. However, within these challenges, I have some the growing global focus on inclusive development, human rights, and sustainable healthcare present and more impactful than ever before. If you look at where the global focus on inclusivity is, it places us at a very strong position to let people know of us. So this is an opportunity that we must use. And the rise of digital technologies, including telehealth, mobile health, and all those things, provides new avenues for delivering services to underserved populations. So we have to take advantage of some of these new technologies, so that we don't only stay in Accra here and think that is it. We can, through these technologies, we can also get in touch with people in outside the cities. And as WFOT emphasizes international collaboration and knowledge exchange, I think we can. This can also help us bring innovative practices to Ghana, tailoring them to our unique cultural and social context. And you can see me here all the way. This was some of this international collaboration, and you can see over there in Canada with a gentleman who is wheelchair dependent. We went there to learn how things are done and also give them our knowledge and tell them how we are also doing very well, if not least, in our environment here in Ghana. So this is in Canada, somewhere in Kingston. So now we have some actionable steps for positioning us for social transformation. And as we look to the future, it is clear that the role of occupational therapy must evolve alongside the changing needs of society. Here are some points that I have put down here for as our actionable steps that we can take to position us and the profession to drive social transformation in Ghana. And the first point is about strengthen education and training, increase public awareness, advocate for inclusive policies, leverage on technology, and also collaborate across sectors. These are not new things, but the question is, how best are we putting this in practice? One, if we talk about improving in education and training, you can see us here. We have not actually, we must expand OT education programs and also provide ongoing professional development for current practitioners, by enhancing the skills of occupational therapists. We ensure that we are prepared to tackle complex societal, challenges. For example, we in Ghana here, we haven't rested on our oars since we started 2012, and you can see the first batch of OTs in 2012. This is a lovely picture, and I think they found themselves somewhere in the UK during their third year elective placements. And this is 2012, since we haven't. And you can see some current sort of some programs, workshops and things being organized here in Ghana. We continue to strive to improve our education and what training. You know, we are cognizant with WFOT's minimum standards for education. We also here locally, there's this GTEC that is regulators that ensures that we are doing the right thing. And we also have to be professionally registered with the Allied Health Professions Council and a whole lot of other things that we are trying to put in place or ensure that we go accordingly to keep improving our education and training. It's good to know that it's not just graduate OTs, we, should I say, BSc OTs. We also have diploma OTs, and then we are doing all we can to also bridge that gap, but by allowing or helping them also to join the graduate programs to also become degree OTs with BScs. So we are doing what we can to strengthen our education and training. When we talk about increasing public awareness, you know, through the media, workshops, open days, visits to high schools and community mobilization programs. In fact, Otag, in collaboration with individuals and some NGOs and other institutions, are organizing some of these public awareness activities. And I think it is making the people get to know about what we do and where we matter most. But like I put across earlier on, I mean, how best, or how is it something we do once and then we just stop and lay back for? I mean, we just have to keep on going. And then the third thing is about advocating for inclusive policies. And as you can see in the photo now, we are working very hard, especially here in Ghana. And this is one of the, should I say, we have just had a research done and we were disseminating, giving the feedback to the people. And this is a community, should I say, based research that we did. And what actually this one, the photo you see in, is on inclusive education, you know, about the current policy and how people in a community are aware of, you know, and we have it here. Some of the people were saying, I would say on paper, there's inclusive education, but in reality, on the ground, there is nothing like that. So you can see the relationship between having the policy and the people actually seeing it's working in their lives. So these are some of the things we need to be doing continuously to let the people know what the policies are and what the policies mean to them. And there is this one too that we had some time back. That's it's about the youth with disabilities in the educational system, and that is some of the challenges faced by the youth with disabilities. They talked about discrimination, bullying, stereotyping, and you know, it is through some of these research projects or yes, activities that we can also advocate for inclusive sort of policies. Now, we're talking about leveraging in technology. And I mentioned about we can make very maximum use of our current phones, whether it be in YAM or being whatever, Android, whatever it is. It can serve a purpose by getting in touch with people beyond your reach and discussing their situations and how they can be assisted with health. So all these leveraging technology, yes, we have this year. And this is an app, actually, one of the technologies I think we should be making use of. Is current, I think this was this year, level 300 from the University of Ghana. This is one of group work that some people did. It's called My OT Guide, and according to them, the app allows you find an OT health professional within your vicinity, an app that provides education, all right, education on prevalent health conditions, and it also connects you to an OT virtually. So it is called My OT Guide. I hope this will be further developed for us to see it actually happening. That is well done. This level 300 group, 2023, 24, level 300 group. I hope they are in 400 now. And we also look at collaborating across sectors. And it's also about research. And we have the Queen Elizabeth scholars, the West African projects. And here we have scholars from University of Ghana, KNUST, University of Gonda, Queen's University in Canada, University Education of Winneba, University of Cape Town, Ashasi University. You know, when we do these collaborations, I think we also learn a lot, and we are able to also change the society in which we are. So, in conclusion, I would say, as we reflect on the theme of this conference, that's positioning occupational therapy for social transformation, it is clear that our profession has the power to change lives, not only at the individual level, but also at the societal level, you know, guided by the WFOT vision and our shared commitment to promoting health and well-being through occupation. We have the tools, that is knowledge and compassion, to make a lasting impact on the world around us. So let us seize this moment to position OT as a driving force for society, for social change in Ghana and beyond. Together, we can create a future where everyone, regardless of their abilities, can live a life of purpose, dignity, and fulfillment. It is your world. Let us change it. Thank you.
Thank you so much, Dr. Peter. Wow, that was so insightful. One thing I really got was the fact that our interventions not only restore function, but contribute to general social change. Basically, we want to reduce social inequality. And it is your world, change it. That is our charge. That is definitely our charge. If there are any questions, Dr. Peter is available. We have 10 minutes for questions, please. The floor is open. You can type it in the chat box, or you can raise your hand, or if it's possible, you can unmute as well and speak. Well, it may not be a question, but it may be a submission. that is also definitely welcome.
Well, mine will be a submission. Thank you, Dr. Ndaa. I think this was a very brilliant and insightful presentation. It was more like a journey taking us back to how OT started in Ghana and how we have used the power we have to change even in our little corners. So it's not more of a question, but more like a comment to say that this is a very good presentation, and it would be amazing if we could have the slides so that we can refer to know where we are going. So thank you for the presentation, Doc.
Thank you. Hey, as senior though, it's been ages. I hope you are doing well.
Very well, sir. Thank you.
Great. Thank you.
Okay, so I think there is a question here that how do we navigate political systems that do not prioritize rehabilitation, specifically occupational therapy?
How, that is, you asked about how do we navigate?
Yes, political systems that do not prioritize, sorry, rehabilitation, specifically occupational therapy.
Oh, wow. I think that's a very great question. And I think this is in line with one of the researches I said we just did recently on inclusive education, where we have the policies and then nicely written down, but we don't see the whole thing being demonstrated. So if we can do some of these projects and based on the outcome, what are the people saying? And if we can disseminate this very well to the right people, I think there should be someone who will say, wow, this can bring a change, and therefore it can also have influence on whatever policy that is in existence. And it can also have influence on why it is not happening on the ground, as we got from the, the research that we did recently. In fact, the people did not even know about the policy. So when we navigated to let them know what it entails and also their roles, I mean, it became clear that, wow, we also have some roles to play here. So let's do it. And as we play our role, the necessary authorities will also look at this and probably do what they ought to do. So it is about projects, research, and coming out with views. You can't just go and speak to authorities that this. They know, but they will not take it. But if you go with evidence from research works and things, I think it will have much influence on changing decisions. I hope I've been able to answer this question.
Yes, please. Well, on my part, I believe you have. The person who typed the question, yes, has also agreed. Amazing. Are there any other questions, please, or submissions? Our international audience are also very welcome to join. I know you may not be familiar with the situation in Ghana, but you could also possibly let us know by virtue of what Doc has shared, what is also happening on your part or on your side of town as well. Okay, so Kinani says, thank you for sharing. Beautiful to exercise this diploma program in Ghana. How does it progress to a degree level?
I didn't get the question.
question.
How do we do what?
How do we
Is it a
progress
bridging?
into? Yes, I believe so. That how do we progress it to a degree level, the diploma to a degree level?
Oh, well, yeah. What the Department of Occupational Therapy and the institution that also does the diploma level occupational therapy, we have come together and we